Montegia and Gliazzi fractures. Montegia fractures. Definition: fracture of the shaft of the ulna with associated dislocation of the radial head. Badeau classification. 1. Type 1. Anterior dislocation of the radial head. Fracture of the ulnar diaphysis at any level with anterior angulation. 2. Type 2. Posterior dislocation of the radial head. Fracture of the ulnar diaphysis with posterior angulation. 3. Type 3. Lateral dislocation of the radial head. Fracture of the ulnar metaphysis. And 4. Type 4. Anterior dislocation of the radial head. Fractures of both the radius and ulna in the proximal third, at the same level. Clinical presentation: posterior interosseous nerve, pin, injury. Imaging. X-ray. A line passing through the radial head and shaft should intersect the capitellum in all views. Treatment. 1. Conservative. Minimally displaced fractures in children. Cast in supination for types I and II. 2. Operative, ORIF. Plate and screws using a 3.5 mm small DCP or reconstruction plate. Proper alignment of the ulna to ensure reduction of the radial head. Open reduction of the radial head if reduction fails after ulnar fixation. Complications. Pin injury, radial head instability. Failure of reduction may be due to inaccurate reduction of the ulna, interposition of the annular ligament or radial nerve. Management of complications. 1. If less than 6 weeks. ORIF of the ulna and open reduction of the radial head. 2. If greater than 6 weeks. Excision of the radial head. Gliazzi fractures. Definition: fracture of the distal 1/3 radial shaft with DRUJ, distal radioulnar joint, injury. Variants: fracture anywhere along the radius with DRUJ injury. Fracture of both bones, radius and ulna, with DRUJ injury. Reverse Gliazzi. Fracture of the distal ulna with DRUJ injury. Imaging. Radiological signs of DRUJ injury. Fracture of the ulnar styloid. Widening of the joint space in AP view. Subluxed ulna in lateral view. Radial shortening greater than 5 mm. Treatment. 1. Surgical, ORIF. Plate and screws through the Henry approach for the radius. 2. DRUJ management. A. Stable reducible, immobilization in supination for 6 weeks. B. Unstable but reducible, percutaneous pin fixation from ulna to radius for 4 weeks. C. Irreducible, open reduction due to acute tendon interposition. Complications. DRUJ instability.